With the U.S. accounting for nearly one-third of global coronavirus cases, some doctors in the United States say they've learned a lot on the front lines of the battle against the disease. That includes a better understanding of how to help patients who come in with low oxygen, for example, says the medical director of the Mount Sinai Hospital Emergency Department.
What we saw early on is that as soon as somebody started to get, to 6 liters of oxygen on this nasal cannula, they just got worse and worse, and so we jumped to intubation. Now we're realizing that probably something in between for some patients, like putting them on that high flow oxygen or putting them on that BiPAP, may actually be okay for some. The other thing that we've learned is that actually you can prone people.
Proning is a method of lying patients on their belly that has been successful, explains another internist and critical care cardiologist at Columbia University Medical Center.
The theory is that the lungs are like a sponge, and if you lie on your back for a very long time, that gravity sort of pulls all the secretions and the fluid and mats down that part of the lung, and that by flipping people over, you free up that space in the front of the torso to allow the lungs to open and expand and give better oxygenation, and it works.
She also says hospitals ran short of key equipment, something hospitals in Italy, Spain, and other hotspots have also experienced.
We all wished, for the sake of people, that we had recognized that this was coming earlier, could have had things in place for hospitals to manage patients, probably could have prevented a lot of the mass amounts of people that came in all at once, had more PPE available so that people weren't without it.
Internist Dr. Anju Gawel says the most surprising has been how the virus affects the elderly.
What I did not recognize was the severity of illness that would be seen in patients who are older. Had we known that, we could have instituted more restrictive control measures to prevent exposure to that group, and also to get very early treatment for that group to try to prevent the complications.
For most people, the disease causes mild symptoms such as fever and cough. For some, especially older adults and people with existing health problems, it can cause more severe illness, including pneumonia, and can lead to death. Mariama Diallo, VOA News.